Hi, my name is Almareli.
My name is Pedro.
Now I speak about the congenital heart disease.
So during this presentation, we will be discussing the following topics: the definition of the disease, the symptoms, the types, the causes, the diagnosis, and the treatment. Next one. Okay, so the congenital heart disease is a general term for a range of pure defects because congenital comes from the birth defects that affect the normal way the heart works.
Okay, the symptoms of this pathology. Patient personal blue change to the skin or lips, or cyanosis, rapid breathing, rapid heartbeat, extreme tiredness and fatigue, fainting during exercise, swelling in the hands, ankles, or feet, swelling in the legs, tummy, and around the aches, shortness of breath in babies during fighting, and in older children and adults during exercise.
Okay, so the types of congenital heart disease are the coarctation of the aorta, or COA, which is where the main artery, the aorta, has a narrowing, which means that less blood can flow through it. The COA can occur by itself or in combination with other types of heart defects, such as ventricular septal defect or a type of defect known as a patent ductus arteriosus. The narrowing can be severe and will often require treatment shortly after birth. There are others, as the pulmonary valve stenosis, which is a defect where the pulmonary valve, which controls the flow of blood out of the right heart pumping chamber of the right ventricle to the lungs, is narrower than the normal. This means the right heart pump has to work harder to push blood through the narrow valve to get to the lungs. The septal defects is where there's an abnormality in the wall or the septum between the main chambers of the heart, and there are two types: the atrial, which is where there's a hole between the two collecting chambers of the heart, the left and right atria. And when there's an AZD, the atrial septal defect, extra blood will flow through the defect into the right side of the heart, causing it to stretch and enlarge. And there's the ventricular septal defects, or VCD, which is a common form of congenital heart disease, and it occurs when there's a hole between the two pumping chambers of the heart, the left and right ventricle, and this means that extra blood will flow through the hole from the left to the right ventricle, and due to the pressure difference between them. The extra blood goes to the lungs causing high pressure in the lungs and a stretch on the left-sided pumping chamber. There are other, as the transposition of the right arteries, the underdeveloped heart, um, and the causes. There are different causes. Most of them are, no, like I see, is congenital heart disease is caused when something disrupts the normal development of the heart. Um, it can be through genetic conditions, like the most common genetic condition is the Down syndrome, which is the most widely known genetic condition that can cause congenital heart disease. Children with this syndrome are born with a range of disabilities as a result of a genetic abnormality. And half of the children with Down syndrome have congenital heart disease, and in many cases, is a septal defect. And there are other two genetic conditions, which is the Turner syndrome, which is a syndrome that only affects the females, or the Noonan syndrome, which is a genetic disorder that can cause a wide range of potential symptoms, including pulmonary bulb stenosis. There's also another cause, which is from the mother, one of them being if the mother has type 1 or type 2 diabetes. Um, there's a higher risk of giving birth to a baby with this disease, the congenital heart disease. Um, this doesn't apply to diabetes, which is a type of diabetes developed during the pregnancy, and when the baby is born, it disappears. If a pregnant woman drinks too much alcohol during pregnancy, it can have a poisonous effect on the tissues of the fetus, and this is known as fetal alcohol spectrum disorder. Children with this Diana, disorder can have congenital heart disease, such as atrial or ventricular septal defects. And lastly, if the mother has rubella, which is an infectious condition caused by a virus, it can be serious on a newborn baby during 8th to 10th week of pregnancy, but it usually doesn't affect much on adults or children, and it can cause multiple birth defects such as congenital heart disease.
Um, okay. The diagnosis congenital heart disease, my initial base suspect during a routine ultrasound scan of the baby in the womb, especially ultrasound called fetal echocardiograph, will then be carried out at around 18 to 22 weeks of the pregnancy to try to confirm the exact diagnosis. Okay. Diagnosis. Diagnosis during pregnancy. This might also be taken if there is family history of congenital heart disease or where there is an increased risk. Echocardiography is a type of ultrasound scan where high frequency sound waves are used to create an image of the heart. However, it is not always possible to detect heart defects, particularly mild ones, using fetal echocardiography. Diagnosis after the birth. It's sometimes possible to diagnose a baby with congenital heart disease shortly after birth if some of the characteristics or symptoms of congenital heart disease, such as a bloating to the skin or lips, cyanosis, are present. Your baby's heart will be checked as part of the newborn physical examination. The examination involves observing your baby following their pulse and listening to their heart with a stethoscope. Heart murmurs are sometimes picked up. However, some defects don't cause any noticeable symptoms for several months or even years. You should say your GPFU or you should show signs of the condition. For the testing can usually help to confirm or rule out a diagnosis. And the treatment, the majority of congenital heart disease problems are mild heart defects and don't usually need to be treated, although it's likely that you have regular checkups to monitor your health in an outpatient setting throughout life. Thank you.